In this video, we are going to discuss about multiple endocrine neoplasia or the MEN syndrome. The first point we have to remember that all the MEN syndromes all of them have autosomal dominant pattern of inheritance. Now, there are three important MEN syndromes that we have to remember: MEN 1, MEN 2A, MEN 2B. MEN 1 is caused by mutation in the gene MEN 1. Okay, the gene itself is MEN 1, which is present on chromosome 11. And this encodes a protein that is known as the menin. So the product of MEN1 gene is menin protein, and this is actually a tumor suppressor protein. MEN2A and 2B, both of them are caused due to mutation in RET proto-oncogene. So RET gene, it is actually a proto-oncogene. This codes for receptor tyrosine kinase. And actually this is a proto-oncogene compared to menin, which is a tumor suppressor gene. And this is present on chromosome 10. This is about the genetics. Now we'll come to the clinical features. MEN1, as you can see here, it is characterized by 3 P's. So pituitary, pancreas, and parathyroid. In the parathyroid, they will have adenomas. Parathyroid adenoma. Pancreas, they will have various pancreatic neuroendocrine tumors. The most important one is Zollinger-Ellison syndrome. They can also have insulinomas, hypomas, and various other pancreatic neuroendocrine tumors, but the most important one is Zollinger-Ellison syndrome or the gastrinoma. Pituitary, also they can have adenomas, pituitary adenomas, and the most common adenoma is the prolactinoma, which is followed by growth hormone secreting tumors. Okay, so among the pituitary adenomas, the prolactinomas and the growth hormone secreting tumors are important. And among the pancreatic neuroendocrine tumors, these are the Zollinger-Ellison syndrome is important. That is the most common associated with MEN1 syndrome. Apart from that, they can also have some other manifestations, usually cutaneous manifestations, that is facial angiofibromas, collagenomas, and apart from that, they can also have meningioma. So these are the points about MEN1 syndrome that you have to remember. Now coming to MEN2A syndrome. So MEN2A is 2P and 1M. 2P and 1M. So 2Ps are parathyroid and pheochromocytoma, and 1M is medullary thyroid carcinoma. MEN2A in comparison to MEN1, it is usually associated with parathyroid hyperplasia. It can cause, it will also have pheochromocytoma and medullary thyroid carcinoma. So medullary thyroid carcinoma, it arises from the parafollicular C cells. It arises from the parafollicular C cells of thyroid, which produces calcitonin. Okay, so this produces calcitonin. Now coming to the MEN2B, it will have 1P and 2M. So basically MEN1 will have 3P, MEN2A 2P and 1M, and MEN2B 1P and 2M. So 1P is pheochromocytoma, 2M's are, one is the medullary thyroid carcinoma, and the other M is mucosal neuroma, and also you can remember Marfanoid habitus. You can also remember that these patients may also have, intestinal ganglioneuromas. Intestinal ganglioneuromas. As you can see in this image, so this patient is having marfanoid habitus, and you can see the mucosal neuromas. So these are the features of MEN 2B. Okay. And one more point, the last point that you have to remember is this: if the patient have MEN 2 syndrome and they have this medullary thyroid carcinoma, you need prophylactic thyroidectomy in the family members. Okay, so if you are at risk of this medullary thyroid carcinoma, you need prophylactic thyroidectomy. So that's all about the MEN syndrome.